Health officials in British Columbia say measures put in place to prevent the spread of the coronavirus are working. New modeling data shows the province has been successful at flattening the curve. Dr. Bonnie Henry says everyone who is following public health advice deserves the credit.
It is the work that we have done together to follow that advice, to stay close to home, to stay close to our families, to keep those safe distances, to clean our hands, to stay away from others if we're ill. That has has made the difference for us in British Columbia, and we are profoundly grateful because it is the way that we have come through this together, but we're not out of it yet. We're still in the eye of that storm.
So for more on the update from BC officials, let's check in with CBC's Susanna De Silva. So Susanna, what else stood out for you from that updated modeling?
Well, you know, we've talked so much about flattening the curve, planking the curve, as Dr. Tam has said. So we heard from BC today saying that they believe they flattened the curve and that they have some cautious optimism that beyond that, they may be taking that next step of seeing that curve begin to dip slightly. Now, it, of course, is cautious optimism. They are couching everything they've been saying by the fact that people need to continue doing what they've been doing. And now is not the time to remove your foot from the gas pedal, so to speak. But that is a significant step. BC, of course, the first province to announce their modeling, and now the first to do the sort of second round of that. Now let's take a look at that curve in BC and how it compares to some of the other provinces in the country. On that curve, you'll see BC is in the red line there. You'll notice it is longer than the other lines of the other provinces. That's because the data begins when there's 2 cases per million in terms of population. So BC did reach that before the rest of the provinces. But you see there it is a flat line. It's a similar trajectory to New Brunswick, Manitoba. Few others like Quebec, Ontario are still going up. We've talked in the past about some of the differences that may have contributed to that, like earlier spring break in Quebec, for instance. And now let's take a look at the death numbers as well. Those numbers are continuing to go up, even here in BC, not as dramatically as Ontario and Quebec. Most of the cases here in BC, like those other provinces, are in long-term care facilities. They do say they expect to see more deaths, but that they do believe that the actions that have been taken here have meant there have been fewer deaths and fewer cases, even than some of their best and most optimistic projections. So they do believe it has made a difference.
So given the numbers that they're seeing now, what are they saying about when restrictions could start to ease off?
And that is the question that everybody wants to know. They say they are beginning to look at that. That is what they're looking at now, but that they need to continue to see a drop in cases, a drop in hospitalization numbers. There are 43 new cases today in BC, but they wouldn't give any goalposts, any specific numbers that they're looking at in terms of targets to reach for those things before beginning to ease those restrictions, but that they are looking at that they do want to see and have the capability to do more testing, including those blood tests to look for the immunity levels that are out there amongst the population, but that they could be looking at resuming non-urgent elective surgeries by the middle of May and more diagnostics. So that's good news for anyone who has been on waiting lists and waiting to get surgery that they needed, and that they need to find the sweet spot of balancing, removing restrictions and not seeing a surge in the virus. And they're doing what they call dynamic modeling, where they look at scenarios. If we remove this restriction, what is going to happen in terms of the virus? And let's show you one of the ones that they are looking at. This one looks into June and what would happen to hospitalizations in critical care if they were to reduce restrictions. So looking at that projection there, 30% of normal is the red line. So that's what they believe we are currently at in terms of normal life, 30% of that. If we loosen things up a little bit, that purple line is 60% of normal. You see the line still maintaining flat, but the red line would be going back to what life was like before with no restrictions, and you can see that sharp increase. Now, looking at that, it looks like 60% is that sweet spot. So Dr. Bonnie Henry was asked, what would 60% of normal life look like for people? She could not give specifics, but did give a few examples of what we might see.
We have to find that balance. We need to find the balance of how much contact still protects us in our communities and our families, but allows us to open things up. So I can't tell you exactly what it looks like, but I can tell you we're looking at every specific part of our society, and it needs to work together. It will be some hybrid for a period of time. There, where people are working from home and smaller numbers are in the workplace, for example. I don't think we're going to be getting away from having smaller numbers in our grocery stores and lining up and having those patients to do that in the near future, in the coming months. But we need to look at how we can increase our social interactions as well, because we know that's important for us, for our mental health.
Now, she did also talk about schools and again, a sort of hybrid idea that perhaps some kids going back, some still working from home or alternating when they are there, also that you can keep that social distancing. She did say, though, that she did expect more social connections in the summertime, that it's still too early to have patience, but that some of that will be coming in the summer, but not to expect any international travel before the end of the year anywhere in the world. And again, cautioning that this is a very long road ahead and that people cannot take this to mean that they can let up on maintaining the social distancing.
Absolutely. But Susanna, thanks for that little bit of good news on the weekend.